All right, guys, I want to tell you a little story about my son that has autism. And unfortunately, he ended up with a bad sore throat. We didn't know what it was exactly. The doctor said it looked like it was a little too inflamed for her to, to swab him for strep throat. So she sent him home with some antibiotics. The name of the antibiotic starts with the letter A. I don't know if I can get in trouble for saying the name or not, but try to avoid that antibiotic. Unfortunately, they prescribe it a lot. Anyway, after a couple of days on this antibiotic, he ended up going nuts. I mean, punching holes in the walls, wanting to fight, screaming on top of his lungs. We didn't know what was going on whatsoever. So we assumed the worst. We started looking it up, and we assumed it was something called pandas. He had this in the past. We had to treat it with antibiotics for almost a month and a half until we got it under control. But now, we had to put him back on this antibiotic. We assumed it was strep. The doctor didn't want to swab him because it looked like he was already in pain. But anyway, 2 days after this antibiotic was given to him, he kind of lost it. Trying to calm him down was very, very difficult. We had to increase his medication in order to keep him nice and calm. But we ended up thinking maybe it does have something to do with the antibiotic, so we gave him something else, a different kind. And we kept him on the medication that he was on increased, just to keep him, mellow, basically, so he wouldn't go ballistic on us. Anyway, so we had him tested. We had a blood test for him. We ended up testing him for pandas. We ended up testing him for strep in his bloodstream and everything else. We said we're doing a blood test on him, so we tested everything else on him. Everything, thank God, came back negative, that there was no issues whatsoever. So later I looked online and I find that there are many, many, many parents out there that are complaining about the same thing off of that antibiotic, that their kids basically went crazy after going on this antibiotic. So I want to tell all the autism parents out there, before assuming the worst, look at the antibiotic you gave your son or your daughter before jumping to conclusions that it's pandas, because we were losing it, honestly, ourselves, because we were so scared and worried for him. We didn't know what to do. So I just want to put this out there, that before you assume the worst, that you look at the antibiotic that you're giving them and know that one of these antibiotics is actually causing the issue. After we took them off, we decreased the medication after, let's say, about a week, and everything was fine after that. So do your research. Look online. There is plenty of people out there that are saying the same exact thing I'm saying. This antibiotic is what the cause. I don't know what it is. Maybe it aggravates their stomach. Maybe but I don't know. But at the same time, I can tell you that it is not. It's not the child that just has behaviors. It is the antibiotic that's creating it. So hope this helps somebody or anyone. Hopefully at least one of you can get some help off of this video. I just wanted to post it and tell you guys our experience. There's a lot of people out there that want to give you a bunch of fluff and trying to make money off of this situation when you and your family are suffering, not knowing what to do, and feeling stuck. Don't know what the next step is, because doctors don't. Many of the doctors don't even know what pandas is. So it's very hard to treat. It's very hard to find someone that that even believes you. They automatically think that you're crazy too. But don't jump to that conclusion right away. I just want to give you the straight on our situation, and I hope this helps somebody. Thank you.